In today's complex healthcare landscape, understanding the rights of health insurance plan members is more critical than ever. Being well informed about your health plan rights empowers you to make better healthcare decisions and to advocate effectively for your needs. This knowledge is crucial in navigating the healthcare system and in understanding what you are entitled to under your health insurance plan. What is health insurance exactly? It's talked about a lot, but how does it really work and why do we need it? Do you know your right under the health insurance policy? Today on your favorite health TV talk show, The Physicians, we'll be discussing understanding health insurance, your right under the health insurance policy. Do stay tuned. It's another day on your favorite health TV talk show, The Physicians, where your health is our business. Today on the show, we'll be talking about understanding health insurance, your right as a citizen. My name is Dr. Memuna Yusuf Kadri, your regular anchor on the show, and of course with me is my delectable co-anchor.
My name is Dr. Martina Agbere. Welcome to The Physicians, where your health is our business.
I'm not even going to go into what's your right. As a citizen,
I'm entitled to
name it.
Accessible healthcare,
okay,
affordable healthcare,
okay,
and what else?
No, I asked you a question because now you say accessible. How accessible is it health?
No. First of all, those are the basic things.
So accessible, available, affordable, and must be acceptable by you.
Absolutely, those are my rights.
Okay.
So as a citizen, those are the basic things the government is supposed to provide for me.
And are they providing it?
To an extent they are.
Okay.
To an extent they are. But unfortunately, how many people are actually aware of their rights?
No, my biggest issue with health insurance as a physician is that people think everything is a fire brigade approach. We still lack the preventive health culture here, in the sense that until there's a problem, you see people now rushing, and at that point you are doing out of pocket payment. And out of pocket payment, you know how bad it can be.
What I want to say is, I think it's the mindset that people have,
which is behavioral.
Yes, apart from behavioral, the mindset, the attitude that they have that car insurance, what obtains in car insurance,
and people do a lot of people do car insurance.
Exactly. So
they
think it is the same thing that happens.
When it's not comprehensive, it's not party.
Exactly. And when you have a problem with your car, do they really come to your aid? So they think it's the same thing that happens in health.
No, this is why we have a guest who is a guru in this sector and is going to help us school Nigerians the importance of having health insurance, so that when and if you need it, you do not have to do, because healthcare is not cheap anywhere in the world.
I am more excited because if you already have a health insurance as a policy, then it's good, you know your rights.
And then you should pay for it and use
Absolutely.
it. So Martina, the beauty about health insurance for me is that my annual checks is covered and I can use it anywhere in the country because they're in different parts. You don't have to be living in Lagos and use it when you need it. Anyway, please call all the members of your family, call your friends, tell them to log in for your favorite health TV talk show, The Physicians, where your health is our business. Today we are going to be discussing your rights under the health insurance plan. Stay tuned, we'll be right back.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body,
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you are just joining us, of course, this is your favorite health TV talk show, The Physicians, where your health is our business. We will not keep saying it. Yes, it's your favorite health TV talk show, and because your health is our business. And if you've been with us for a while, this person we brought on set today is not a new face. he has been schooling us a lot about health insurance, the importance. And if at this stage you have not, because of us on this show, gone to do health insurance, then this time around, it must sink in. It's no other person than Dr. URAN-YORK, who is the MD CEO of ROTHAUGE Healthcare Limited. Because insurance is paramount to your well-being, we are going to welcome our working encyclopedia, Dr. Ente. You're welcome on set, sir.
Thank you very much.
See the way Dr. Ente is sitting there. Yes, today, health insurance, if you don't know it, they say not be for anybody, but you must be for your health insurance this year.
Yes.
Thank you very much, doctor.
Dr. Ente, you know, the first thing now is let us even know this health insurance thing, because I think if we don't remind people about it, because if before we even go to the rights, letting them know the health insurance and why we'll continue to talk about it for them to understand more about it.
Well, my name is Dr. URAN-YORK. I'm the MD CEO of ROTHAUGE Healthcare Limited. I've been practicing health insurance for the past 22 years.
Wow.
Health insurance simply means a policy you take out to protect yourself and your loved ones against the risk of ill health. Granted, when ill health occurs, you might not be readily be that buoyant to pay for what she mentioned as out of pocket coverage, because there are so many competing needs for your income. Right. The rent is there, the children's school fees is there, food is there, and clothing is there. You know, so health insurance policy is taken out for 1 full year. You can either pay a lump sum for the 12 months, or depending on your cash flow, the health insurance organization, which we otherwise call health plan or HMO, can allow you pay monthly, quarterly, or bi-yearly. But the most important thing is that the health insurance premium must be paid. Now, once health insurance premium is paid, then illness strikes, you can just go to the hospital and you're cared for. So, in a nutshell, this is the meaning of health insurance policy. It's the same with auto insurance policy. And, you know, the government has been trying to make people understand what is health insurance. And we, again, we have to educate people. Because there are so many persons today that have a car insurance policy, but they do not have health insurance policy. So which one is more important?
Health, of course. Because if you are not alive and healthy, you drive a car.
Listen, Dr. you already talked about the importance of health insurance, what it actually means, and people probably having to pay out of pockets if they are not insured, right? So it means it's actually very, very important that we all have health insurance policy. And coming to think about it, I think it should be part of our annual budget as a family. When you're planning for your budget, what you need to do in a year, setting money aside, most people should at least be advised to also have that thing in place.
Because health is wealth.
Health is wealth. Because it really baffles me the way we always put health, not even on our lists. There's only when a challenge crops up that we now begin to look for funds to cater for that. So if we put it as part of our list, set money aside, register for a policy, right? Okay, so now my question is, if people know that this is what they're supposed to do, you and I, are we going to have the same policy? So what are the types of health insurance policies that are available? Because the bourgeois, the type of policy they will take is not going to be the same with that from the common man, the people on the street, the market people. So do we have insurance that covers every cadre?
Thank you very much, Dr. Martina. There are categories of health insurance policies.
Okay.
The most of the terminologies that most of the HMOs or health plan use are, they call one bronze, silver, gold, platinum. There are some people that write diamond and titanium. Now, the most important thing is that it is the same drug that will be used to treat everybody comprehensively, but amenities differs.
Okay.
If you're a bronze plan, you can say in a word for 4. Mind you, when you fall ill, your problem is not the type of accommodation you stay.
You're right.
People on
Yeah,
silver
well.
plan can stay in a ward for 2 persons. Then the executive will stay alone.
Okay.
They will have a TV to themselves to watch. They will have internet in their room and all that. So these are amenities.
Okay.
If they need surgery, it is the same surgeon that operates on the person
On bros.
on bronze that will operate on you
In titanium.
that have titanium or that one also. So it's like, okay, some people may buy a low brand, brand Toyota, low grade Toyota.
Yeah, maybe
While some
something
people want to
brand.
drive the big Mercedes Benz. But what do the cars do?
They
Is
take
to
you to
take
the
you from
destination.
point A
To
to point B.
And it's where they all use.
Within the level of comfort will be different.
Different.
So, and again, do not forget that what is paid as premium to health insurance companies is usually dependent on the amount of money you earn. Everybody does not have the same level of education, and they don't have the same earning power. So that is what determines who is on platinum, who is on gold, who is on silver.
So you cannot
who is on
lie.
bronze.
And bronze.
So that is how it works. So these are the different types of, there are some health insurance policies that take care of comprehensive medical examination. But don't forget that comprehensive medical examination most of the time happens once in a year. These are examinations that can, tell the physician things that can happen that will not happen. But granted, each time the bronze guy goes to see the doctor, BP is done,
Yes.
blood sugar check is done, your other vitals are done. So, to a very great extent, this can throw up what can make the physician to investigate you further. So, to me, the way you plan for your children's school fees for the year, you plan for your rent for the year, if you're not living in your own home, you plan for, everything. That is the way you should plan for your health insurance.
And I think that's on period.
Yeah.
Because there's no other way you can say it better than how this is. And if for anybody out there as a family, you are putting strategy for the year, as a company owner, you are putting strategy for the year. Even as an employee 9 to 5, you're also planning on how you commute from your house. So your health insurance should be at least the first 3 on your list. Because if you plan to fail, if you fail to plan, you have already planned to fail. And when it comes to our health, because we know that health is wealth, it's paramount that we make sure that we have insurance.
Absolutely.
So now they will know that we are talking about health insurance policy. We say understanding health insurance policy as an individual, as a citizen, you're right. So what are the rights of that citizen?
Thank you very much. Now, let us assume that you have a health insurance policy. You need to know what are your rights. Now, the consumers or the companies have an agreement with the health insurance organization, which are the HMOs. The HMOs have agreement with the healthcare providers. Now, the HMOs and the healthcare providers also have agreement with the regulator, that is the National Health Insurance Scheme. All these agreements are to protect just that in you, the consumer. So, the number one thing we beg them to understand is, what does your health insurance policy cover? Because some people don't know. You probably may be entitled to a ward for 4. And when they said, okay, this is your bed, you say, no, I want private ward. But if your HRO doesn't tell you, you will know. Now, health insurance cannot cover everything. There are limits of coverage. Your surgical limit can be 500,000. But maybe that surgery you want to do is 600,000. At that point, you will have to pay that extra. But most health insurance policies is written in such a way that 85% of what you will need is paid for. Now, there is something too that we want people to understand. The cost of care differs from one geographical location to the other, maybe because of brick and mortar.
Okay.
The cost of doing an appendicectomy on Victoria Island or Lekki Phase 1 will not be the cost of doing the same surgery in Surulere.
Oh, wow.
The cost of doing appendicectomy, say in Port Harcourt GRA, cannot be the same cost of doing it in DOP in Port Harcourt.
Right.
But it is the same surgeon that will go. The difference may just be because of the brick and mortar.
Okay.
It's the same drug that you'll be given. So you have to know what you are covered for. You have to know what is not covered. That is what we call the exclusions. From my experience, for most of the time, the HROs keep this agreement to themselves.
Without telling the staff.
Without telling the staff. But you see, we've been trying to bridge this gap by putting together what we call how the scheme works.
Okay.
So at inception, we go to talk to staff that this is how your scheme works, and we'll send it to them. Some will read, some will not read. And you know, when they go to the hospital, they'll be doing trouble with the hospital, the reception, they'll do the problem with the doctors, as if, you know, it happens. We are physicians and we know what happens, and even consumers and all that. But it is important that healthcare HRO practitioners tell people. So that is the number one thing that you will know. Then the second thing that you will know about health insurance coverage is that there are some medical services that will need pre-authorization.
Okay.
You cannot just walk in and have them. So when you walk in and you are being billed for the service, the HMO will now send notification to the hospital will now send notification to the HMO to give them the code. But mind you, this happens only in elective situations. Okay. If it's an emergency, there is a rider that please go in and get it sorted. We will serve your authorization code in 24 to 48 hours when you inform us. And this, everybody knows. But there's something that has always been a sore point between consumers of healthcare, HMOs and providers. Somebody can have a headache at 2 p.m. in the office just because you cannot walk up to your boss and tell your boss that I'm not feeling well. I want to go to the hospital. The same guy will work till 5 and appear in the hospital at 8 p.m. and tell the doctor that this is an emergency.
When you spend like 6 hours in between.
When the doctor knows that this one is not an emergency, it's not even an urgent situation.
So go bring your code.
So, you know, so we have to keep educating people and all that. Now, the next other thing that you will know, you will have to know, because it is your obligation towards the health insurance policies, that you will have to pay your premium.
Okay.
It's either your organization pays the premium for you if you are under an employer-sponsored healthcare, or if you are on your own, you have to pay your premium. If you don't pay your premium, you might not get care. And then there are some situations where you have to co-pay.
Okay. What does this premium cover? What does it mean?
The co-payment.
Premium.
What does it cover?
What premium is that fixed amount of money you pay per year.
Okay.
So that your policy becomes active.
Whether you access healthcare or not.
So that you can access healthcare.
And that's what percent?
Well, if the organization has to deduct it from your salary,
okay.
Most of the time, usually 5% of your basic.
Okay.
Then your employer will match it up with 10% from them.
So in total 15%.
Total 15%. You know, but depending on the coverage, it may be more.
Wow.
So it is not fixed. And again, if it is an employer that the pocket is deep, they may decide to pay for you outright so that you don't pay anything.
Okay.
You know, all categories of work do not have the same bottom line. Some work, you know, the profit is much, some the profit is marginal and all that.
So pray that the pockets get deeper.
Exactly. It's to pray.
Yeah, so pray that the pocket of the organization gets deeper. There are even organizations that the pocket is so deep that they establish comprehensive health care within the vicinity of the organization.
Yeah, they don't go out.
I can name them, you know, but for the purpose of this a discussion. We are talking to the generality of the public. You know, granted, this year, I bet you, somebody has called you for medical disease.
Sure.
Please, my daughter.
It's normal.
It's even more now.
Especially because of the economic situation that we
hardship,
pray that we get
We
ourselves
get
out.
out.
You know, no, we'll get
get
out.
ourselves, we will.
Organizations go through turbulent times. Nations to go through turbulent times. But
yeah.
let us not succumb to what is happening here. It is even in this situation that everybody needs health insurance. Because the little money we have now, it is the essentials that is key. And if you think it is only food and rain that is essential, you'll be surprised when illness strikes. Because illness will not, give you warning that they want to strike. So that is the reason why we must keep preaching that people understand that health insurance policy is key. And they need to even understand their rights under health insurance. Another thing that is your right is you must know how to vent your annoyance, grievance procedure. If you go to the hospital and you are not treated well, if you go to the hospital and you are abused, because there's something that happens in this country, elsewhere though, that we have to talk about it. Because most of the healthcare providers knows that the HMO will pay them at the end of the month or at the end of the next month. They prioritize walking out of pocket payment patients.
True.
So HMO.
Very true.
Very true. Yes.
When you get there, they will say, okay, HMO, please sit down. They will delay you. They rather attend to those that come with money. Yes,
wow.
that's true. Very true.
Well, I think it's everybody's
very true.
So
that's why most of the patients will complain that they wait
waiting time
for a long time.
But let me explain another thing about that waiting time. People at times we're careless in our environment. You will see a man that has a health insurance policy. He brings out his card. He brings out his wallet. You will see 3 ATMs. But he'll be looking for his health insurance card that is the size of his ATM. And he'll be telling I have forgotten it at home. Or it is with my wife. When your wife has her own, the kids have their own. I will say, and when you say, what is your health insurance policy number? They will not know. But
they know their GSM number.
They know their account number, especially the ladies. They know their account number. So under such situation, thank God to take.
Yes, snap and have it as a soft copy.
Yes, you can snap it and have it as a soft copy, or the hospital can throw in your first name.
Exactly, and then to come,
on the final notes, somebody who used to be a staff, retired, really used to benefit from the system after retirement. He came to me in the office and said, I went to my provider and said, I'm not entitled. I said, yes, you're not entitled to it anymore because you're retired. And we don't have anything for retirees at the moment.
So retirees, a lot of them go out of pocket.
Out of pocket. So I explained to you, go to the provider, if you still want to use that same provider, and let them know that you want to pay
it out of pocket. That's your whole 50%.
He left was very, very miserable. He was very upset. I said, but that's a reality.
Dr. Martina, this is because of lack of information. The National Health Insurance Authority, they have a program they call
Yes, for the elderly, that one,
so, I am sure this is a discussion for another day.
It's a discussion for another day. Thank you so much, Dr. And I'm sure for all our viewers out there, it may be short, but I'm sure we are very certain that you got something from this discussion. Understanding health insurance policy, but most importantly, your rights. And what does it entail? What do you need to do? How do you ensure that when you get to that hospital, that service provider, you know what you should demand for and what you should get? Because at the end of the day, health is wealth. Because if you are not healthy, you can't be wealthy. My name is Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
Thank you very much, Dr. Sensei, URAN-YORK. Nice having you again on our program, The Physicians. I will look forward to seeing you again to come and blow our minds and the mind of our audience about what we have in the office. And to our viewers out there, we just want to say thank you for keeping a date with us. Remember, if you don't have a policy, go for one now. One thing you must know also about your rights. When you get to the hospital, you have equal right with those that come with cash. You have equal rights. So because you just have you just have been paid for. So do not agree. Don't agree. Don't take it. That because you have an insurance, you have to wait. No, you have the same right as a person who comes with cash out of pocket. Till next time, stay blessed. My name is Dr. Martina Agbere.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.